I was asked to speak about this very complex topic, which is how we strive for excellence. And I wanted, as Rod indicated, to make it relevant to today and not just speak in general platitudes. And, the thing comes up, why would you discuss this topic at all? What's the interest level? And my wife, Amy, who I met when I was an intern at USC in neurosurgery, she talks about this with me all the time. She always tells me to just worry about being an excellent doctor and surgeon. And this is a picture of her many, many years ago, of course. So, let me just say it's impossible to cover a topic like this in 15 minutes, but I'm going to try to touch on some of the elements that people might have a particular interest in this. And, one of the reasons to talk about this, and I've had lots of patients, I don't have any social media presence. So when you look for me out there, I try to really, I don't really care about what people do in social media, but they always find the SSF videos. And, it's interesting because I have talked about this before, that we as spine surgeons, we are constantly under assault. And so the importance of being excellent is greater for us, I think, than any other group. So, there are many elements of what we do, like being economically excellent, right? This involves understanding how healthcare is bought and paid for here in the U.S. And understanding that societal excellence, how we talk about distribution of resources politically and socially inside of a nation, and scientific innovation, research, and the things that we do, and where we sit in all of this. And I think even the fact that we have this conversation as spinal surgeons already sets us apart in a way amongst doctors. So I asked some experts, I said, listen, what is it about us that makes us excellent, right? So I posed the question to a couple folks. So first I asked Alex Vaccaro, and Alex says, spine surgeons, they really have less impact on the public health than, garbage collectors, right? Which I said, well, I get it. Like Philadelphia's got that problem, in New York City too, but I understand what you're saying. Sanitation workers do the grind, and without them, society would probably fail to function efficiently. So maybe in that light, spine surgeons and our search for excellence has very little real reach. But then I probed other experts, and I talked to Dr. Barth Green, who was chairman here and basically founded our department of neurosurgery. And he said, listen, Mike, you got to understand that that's true, right? Because we can only touch so many lives as spinal surgeons. But when we have that interaction with individuals, it's profound. So, whereas the garbage collector picks up your garbage every day or every week, the impact of that to that individual is somewhat remote, whereas what we do is highly, highly intimate. And then Chris Shaffrey says, that basically tells you why almost every adult has been affected directly or indirectly by what we do, because what we do is so important that every time you talk to somebody, they're like, oh, yes, somebody, my cousin or my wife just had spine care or even spine surgery. And what does that really mean? So, let's take a look at this, what this means in the news. So here's an example. This is from the Wall Street Journal earlier this year. Tech billionaire Elon Musk, right, talks about how he's having trouble with Twitter because of his back pain, that the back pain is impacting him enough that it's influencing his incredible grind of a work schedule. And those of you who follow Elon know that he just had another surgery by a very famous surgeon friend of many of us and another faculty member of SSF. And you can see that he had his scar on his neck, and he had a number of neck surgeries. And so, Elon Musk, the wealthiest man, at least today in the world, is influenced. And then you look at celebrity influencers like Carson Daly, right? Carson Daly had a number of spine procedures, ultimately having a fusion. And look at Adele, right? Another famous artist talking about how the sciatica is starting to affect her touring schedule. So we have a lot of impact. So we need to be excellent at what we do. And do we have a disproportionate impact economically or societally? And well, you think about like politicians and actors and lawyers and professional athletes, money managers. You could make the argument that our impact is less, but I would say the impact is greater. I think that our impact, and when I think about folks like Rod and Jens and some of the folks in the audience, like, John Dimar and some of the illustrious French surgeons who are going to be speaking, the impact is tremendous, right? And so let's talk about the economics briefly, because it really matters. People listening, they're always thinking about the economics, whether they be personal or local. And so what does this mean when we talk about our worth and our value and our level of excellence, whether it's your personal worth, your practice group, your institution, other stakeholders, right? Because let's say this very plainly, spine surgeons have an enormous economic impact wherever they are, positive or negative, hopefully positive, right? So here's different ways of measuring the impact or worth of you as an individual, whether it be a very simple profit by income minus overhead, or let's say collections minus overhead, or it be some kind of RVU-based calculation. I'm just throwing these up as examples. They're not meant to suggest anything, or whether you're on some kind of salary with bonus or whatever your boss says is what you make, right? So these are formulas for personal worth, right? And this is important to discuss because we're at a nexus, a time of change. I know everybody says it's a time of change, but this is a time of change. The last great change in America was in the 1960s, when you talk about the social, economic, governmental revolution and the founding of Medicare, Medicaid. Now we're at yet another type of nexus where so many of the people are becoming hospital employees, and it's affecting even your meetings. People are saying, well, I can't travel because the hospital demands that I only go to one meeting a year, et cetera, et cetera. And this kind of gives you a rubric. I'm not going to read it to you. I don't know who watches this, but you can say that these are factors that might apply in terms of the shifting of folks in generations, from my generation to the next, of how they are actually working as employees. And this has obvious drivers, whether it be how healthcare is bought and paid for, which is that physician reimbursement is getting lower and lower and lower every year, and accounting for inflation much lower, whereas hospital payments are getting higher and higher and higher. And it's obvious where this trend is headed and how that influences us, right? Why am I saying this? Why am I talking about this when we're talking about excellence? Because it's a warning, right? It's a warning because if you think about how this influences human behavior, right? So think about how folks try to game the system, right? Egregious, maybe out-of-network collections and billing. This is from the New York Times front page of the New York Times about a New York surgeon. How people are doing letters of protection and this kind of stuff with car accident payments, overbilling, right? Fraudulent billing, right? Bogus consulting. And here, stuff like this makes us look bad, and selling supplements. And why are spine surgeons in the news for this? And we could have a whole day conference on this. And let's just suffice it to say that we are in the crosshairs, but I suspect that the folks listening and the faculty all try their very, very best to do the right thing for the patient, independent of any personal economic motive. I certainly try to do that. I know Jens and Rod try to do that. So these are things that we think about, right? And why do we talk about it in terms of excellence? Because the economic elements are the most basic paradigm. That's the beginning point, right? And the outsized economic impact we have in so many ways means that what we do matters more. Our actions, our thoughts, our ideas, our teachings matter more. And if you're unable to be excellent, and I observe this personally teaching residents and fellows, what happens is low quality surgery, unindicated surgery, dissemination of bad information. This all changes the public view of who we are. So it's a tantamount to our specialty to be excellent, because we are the highest paid doctors. We are the ones that pay the highest malpractice premiums, right? So we need to be even more excellent. So this is just a slide to remind me of why I do this, which is because I love my family and I love that what I do matters every day in terms of what we do. So this is what we're faced with excellence. The promise with the ACA, Obamacare as they call it, is the promise of higher quality, greater access, and lower costs. And is this possible? And if you go to business school, so I'm going to finish my MBA in about a month and a half, no, it's not possible as a general paradigm. Everybody wants cheaper, more, and better, right? But it is only possible through technological and innovation and systems-based practices, which is something that I know the folks that our faculty are very much into, and we're going to hear a lot about in the next hours. So how do we meet this demand, right, that is being asked of us with an expanding population, expanding graying population? We can work harder. That's incremental, but not transformative. We can work for less, right? But actually, our contribution costs as surgeons is small. The professional fees are minimal. They're percentages. They're single-digit percentages. So even if we did our surgery for free, that would be eroded within 1 or 2 years of hospital growth or any other piece of healthcare administration or insurance. administration. We can improve quality, but yes, are we not trying to do this every day? I can tell you, everybody I know that's on this call today, on the Zoom, is trying to improve their quality. I know that for a fact. And then there's technological and scientific advancement. That's what we're going to hear a lot about. And so if you look at science and engineering economics, this is the U.S. manufacturing output per worker, right? This is important, and we can discuss, all the governmental, political, social realms of this. But let's just say that people are more productive in general, and we need to be more productive. And if we think about doing that through innovation, right? We think about Moore's law. We think about, and Gordon Moore just died. I think it was earlier this year. Right? The doubling of data and information every 2 years, right? But the idea of the law of accelerating returns, that we can use technology to be more excellent, right? And SSF has had so many videos about robotics and technology and osteobiologics and things of that sort. But academically, this is how we address it, right? I know that Jens, he ran University of Washington's orthopedics department. Research, technology, translation are the core competencies of neurosurgery and orthopedic surgery too, if you're a spinal surgeon for sure. And so in neurosurgery, previously all the programs were required. I know Rod did this 1 or 2 full years of research. So UVA was an 8-year residency, the longest in the country. And publishing. So for the young people listening, publishing, making your mark on the future. So here's a discussion about Harvey Cushing, who's the founder of neurosurgery in America. Very, very famous neurosurgeon, created the system we know. And this is just a quote, from 1918 to 1928. So that was 100 years ago. That's a 10-year span. He published 6 books, and it was hard to publish back then. 100 scientific papers, right? And when these reports were analyzed, he wrote about 10,000 words per day. And this is in addition to all the surgery he did, all the drawings, all of his administrative duties at Johns Hopkins and at the Brigham and Women's Hospital. So think about what the charge is of our legacy, right? And what about the future, right? So the last 2 decades, I know when I was in medical school, they wanted more primary care. It's been a prioritization of medical schools, and reimbursement has shifted, right, to try to incentivize non-subspecialists. And there's almost nothing more subspecialized than spinal surgery, whether it's ortho or neuro. Administrative and bureaucratic control. And Hunt Bajer, WNS president, says the next 2 decades will belong to the subspecialists. But cautionary note. This is from Bob Grossman, who's the dean of NYU Medical School, now the hardest to enter medical school in the country because it's a 3-year program. And Bob Grossman's brother, Jay Grossman's my anesthesiologist. He does the awake fusions with us. So Bob is somebody that I know sort of remotely through his brother. But my middle son Evan goes to NYU, and so NYU has a 3-year medical school program because they're like, you can learn everything you need to learn in 3 years, and we can produce more doctors that way. And tuition is free, right? So here's the response to that article in the Wall Street Journal from Bob Woodward, a nurse practitioner. For primary care, medicine only needs to look towards nurse practitioners. Our care is equal to, if not better than, a physician's. Wow, what a letter to put in the Wall Street Journal. This is published out there, right? So think about what this means and think about what that means to us. But I'm going to show you a slide that shows the exact opposite. Nothing against nurse practitioners or PAs, but this is a slide from Archives of Internal Medicine showing a regression line between satisfaction with work-life balance on the y-axis and burnout rate on the x-axis. And as you can see, all the specialties in medicine studied fall along this regression line, meaning the more your life is balanced, the less you burn out, the less your life is balanced, the more you burn out, right? That makes sense, except for look at the outlier here, neurosurgery. And actually, I'm going to put spine surgery in there because the orthopedic spine surgeons are much more like the neurosurgeons. So low work-life balance, low burnout is the outlier there. So think about what we are. That letter says that we're a commodity, that we are to be commoditized, right? To be replaced by ChatGPT. I don't know if you follow JAMA. There was an article 3 weeks ago showing that, guess what? I hate it when people say, oh, the doctors have compassion, bedside manner. Guess what? ChatGPT is better at it. And this article proves it. It proves it because it follows an algorithm and it says, this is what compassion looks like. I've always felt that compassion was a bunch of BS. What someone says feels like it's touchy-feely. It doesn't matter, because what matters, as we know as surgeons, are your actions, not how nicely you frame things, right? You can frame things nicely as you paralyze a patient, and that's actually what happens. What matters is, and I know Jens feels this way, what matters is what you do in the operating room, how you take care of people. We are a profession, and so we strive for excellence. So how we see ourselves, but how the world sees us. This zeitgeist is changing, right? And we need to respond to it with greater calls for excellence, not less, greater calls for excellence, which is being held back. And think about how many hours or days or years or months and how much sweat and how many missed Christmases and Father's Days and birthdays it took to learn how to fix that, or something like this, right? Think about what that takes, and it is not a commodity, I guarantee you, when it's someone else on the table who's being operated upon. So for the people listening out there, how do you spend your time? How do you spend productively your time so you derive pleasure and value, but yet provide excellence, right? Think of all the things that you do every day. And most surgeons I know do engage in these elements, which are elements of excellence and service. So some unsolicited advice, don't judge me for any hypocrisy. Invest in yourself, right? Invest in your team. Take care of your teams. Learn while you can, differentiate yourself, know your customer, right? And understand your needs. Pick a great partner, right? Tomorrow's Father's Day. Pick a great partner. Most of us have great loved ones, spouses, support networks. That's really, really critical, right? So just to close, think about our heroes, NFL players, right? All right. Think about how they are, how many years they work. They work very few years, okay? The average NFL player works, I think, two years and 7 months. That's their average career, right? Yet they spend their entire lives studying game film, practicing, beating their bodies up, and going to play the games, right? What are we doing? Are we doing all of this? And this is a great op-ed in the Wall Street Journal by Dr. Menger, who was a resident at LSU, and he's now an attending, talking about how military surgeons need practice to stay sharp and training. And I need practice every day. And I'm 50 plus years old now. And I still need to practice. And I'm inspired always by the great pioneers. If you think about the pioneers of the world, guys like Sir Edmund Hillary, Neil Armstrong, Jacques Cousteau. And in the neurosurgery realm, and I know orthopedic has the great analogs too. Lars Lexell, Harvey Cushing, right? Victor Horsley, right? These are the roots of our specialty, and they all strove for excellence. So our life's intense. I'm sorry I can't be with you today. Is the graduation for our residents and fellows, so I could not get back from Seattle in time. We have a tremendous number of fellows. I do not want to miss that, and our personal lives are intense. And life is short. So I do want to thank everybody for dialing in. I know this video will be released later, and I want to tell all the patients out there, right? Your spine surgeons, you pick the right one. They're truly dedicated to what you do. Focus on that. You have to have confidence in what we do because we sacrifice our entire lives for you. So thanks again, Jens, Rod, and everybody else on faculty. It's great to see you guys virtually.
Wow, Michael, always great.
We have to move on, but I want to ask you one question, and that is work hour restrictions. So this was one of those major sentinel changes in terms of the concept of changing us from a profession to a commodity, where the extra work that you did and that our generation was forced to do, that dedication towards patient care was taken away in terms of the context of providing a more collective approach with a myriad of checkouts and having the system take over rather than the professional dedication towards a patient. Do you think that in the era of subspecialties, which I hope that we'll witness in the not too distant future, that this will revert back again with a recognition that we can't legislate experience of a surgeon, which is so valuable and frequently takes place off hours?
Yeah, you're right, Jens. And I don't think it can be legislated because the trend is in the opposite direction and the political zeitgeist is too powerful. But I can tell everybody out there, there is no way, it is impossible. You think about the number of procedures a neurosurgeon now has to do, an orthopedic surgeon has to learn. There is no way to train someone in 7 years on 80 hours a week. It's impossible. The only answer is they're inadequately trained, or they have to continue their training after they're done, or they have to be so subspecialized. That's the only other answer. They have to say, I'm going to enter residency in orthopedics, and I'm just going to start doing spine surgery from day one, and I'm not going to do hips and knees. There is no way to keep up with the advancements in technology. It's getting harder and harder, and I don't understand the politicians. I agree with you, Jens. It's scary to me. It's a real problem because we have to take care of real humans at the end.
I was in Europe recently at the Global Spine Congress, and I actually did not know that, but in Europe, they don't have even an 80-hour work week. They have a 40-hour work week, and that's not a joke. And again, the number of surgeries that they did as senior trainees is really remarkable. So I do think that we politically have to really be far more active to allow society to understand what it means to be a surgeon and what experience we have to accumulate to make it happen positively. So.
Thanks for having me.
Thank you.